All right, welcome to chapter 15, and today we're going to be talking about aneurysms. Let's start with the pathophysiology. It's a localized dilation or bulge of a blood vessel due to disease or weakening of an arterial vessel wall. Now, there's different sites for an aneurysm. Usually people think of brain aneurysms. So that's one of them, cerebral, base of the brain. But it also happens in the aorta, so it could be in the abdominal area, and the thoracic area. Now, the cause of it is inflammation, infection, and injury. And the major risk here for people who have an aneurysm is the progressive enlargement of the size of it, tearing of the arterial wall, which we call dissection, and sudden rupture of the artery. Now, some major risk factors for people developing aneurysm is smoking, age, being male, hypertension, obesity, and markers of inflammation. And I just want to kind of read how serious it can be for all of these. So if someone has a cerebral aneurysm, the survival rate after a rupture is 33 to 67%. For an abdominal aortic one, it's less than 50%. And for a thoracic one, it's 20 to 30%. So a lot of what we'll talk about is essentially avoiding that from happening. Now, some signs and symptoms that an aneurysm has ruptured actively is severe pain, nausea, low blood pressure, rapid heart rate, lightheadedness, and confusion. And when this happens, they need to get immediate medical attention. Um, so that's just a little bit about what aneurysms are. So, how does it pertain to you if you're working with someone who has one? Well, the difficult thing about aneurysms is that often, unless something happens, like it ruptures or it starts to, push against organs, depending on where it is, it's asymptomatic and people don't know that it's there. Um, so a big part about the management of an aneurysm, whether they know about it or whether, they're starting to get into that risk factor age group, is continual screening assessments. Now, there's a little bit of talk about what age should screening happen regularly? Male, female, like what are those differences? Well, the US Preventive Services Task Force recommends that everyone aged between 65 and 75 for men definitely gets screened for it with ultrasonography. Um, Now, remember, one of the risk factors was being male, so this is mainly recommended for men. However, because it is an aging problem as well, there are some talks of making it more regular for women as well above the age of 65. So I guess we'll see what happens with that. But it's mainly for women over 65 who have a history of smoking or heart disease. So yeah, smoking is one of the bigger, I guess, risk factors for men and women. Um, Also, a big part of it is just aggressive attention to the underlying risk factors of it. So, stopping smoking if they are smoking is a big one. Lowering their lipids, controlling blood pressure, and managing obesity if they are obese. So, again, big theme of this course is that a lot of people who have certain conditions uh, they usually have other ones associated with it. So, people who have hypertension, dyslipidemia, obesity, so on and so forth, all of it is related. So, kind of similar to the pacemaker chapter. The underlying risk factors are the more important thing here. What kind of medications are they on? Well, we've seen all of these medications, but I've written a note for what specifically it does regarding aneurysm. So beta blockers, we've seen this a lot. It reduces the strength of arterial pulses, and this is actually recommended for people who also have lower normal baseline blood pressure. So in the past, we've talked about how it's prescribed when you have high blood pressure, and it's really helpful if you do. But reducing the strength of that arterial pulse is really good as well, even if someone doesn't have blood pressure problems. So that's a note. They will likely be on this medication. Statins moderate the influence on lipids and the inflammatory markers, and then ACE inhibitors, mainly blood pressure management. And there is some research that may indicate that it can reduce aortic aneurysm rupture rates. So that's really positive if more research comes out showing that connection. So, what are the effects on exercise response? So, when this is caught early or in the early stages of an aneurysm and the dilation is minimal, so it's a pretty small aneurysm, there's typically no effect on the exercise response. And there's been research showing that when you age match people with an aneurysm to people who don't have an aneurysm, their heart rate response and exercise capacity is similar. There's only some slight indications that they have a higher incidence of claudication and hyper/hypotensive responses. So overall, they're at that early stage, there really aren't too many big differences. However, there is some research. Now we've talked about, I guess, the stigma of exercise on people who have certain chronic conditions. There is some research that may indicate that exercise can be associated with aneurysm dissections or ruptures. However, this study was on 262 abdominal aortic aneurysm patients, and it was after the fact. So they collected this data well, after, focusing on this age group specifically. And it was retrospective. So they had one rupture after 12 hours after a maximal exercise test, and that's a incidence rate of 0.4%. So it is pretty low. However, again, it was retrospective, so it doesn't mean that that one rupture was due to the maximum exercise test. It may have been for other reasons, and we wouldn't know. There was another study recently that looked at 306 abdominal aortic aneurysm patients, and they also did maximum exercise testing, and there were no complications reported. So, I think it's, safe to say that exercise testing and exercise in general is pretty safe with this population. Okay, so what are some adaptations that people get from exercise training? Some of these again will be pretty similar to other ones we've talked about because they probably have the same chronic conditions. But anyway, they definitely see improvements in inflammation markers, and that's one of the main things to really control um, for aneurysms or something to at least be mindful of. They also see improvements in vascular function due to intermittent increases in wall stress. And then exercise may reduce the incidence rate and growth rate of aneurysm. So there is some research that is indicating that, which is really positive. And there's, of course, favorable effects on major risk factors, which we've talked about already. So, people who have hypertension, dyslipidemia, so on and so forth. Also, for chronic sedentary individuals, so people who have something like a spinal cord injury or amputation, are at a higher risk for developing an abdominal aortic aneurysm. Um, so it's basically this is one way to say exercise is definitely recommended for this population. So again, going away from that stigma of just rest, don't do anything hard, that's probably going to do more damage in the long run. Also, as we did mention, with like the early stage aneurysms, exercise is well tolerated for those people, and they see pretty similar benefits to those post myocardial infarction. So there really isn't too much research saying that this is dangerous for them. All right, now what about exercise testing? Now this is a little bit more individualized compared to other populations that we've talked about. So um, maximal testing is perfectly fine for abdominal aneurysms that are smaller than 5 centimeters. So that's again maybe early stage ratings, I suppose. However, it's important to monitor the rate pressure product, which is essentially heart rate times systolic blood pressure. Um, and yeah, we want to avoid a rapid rise of that. So definitely monitor blood pressure and heart rate. I mean, you should be anyway, but just just reminders. So that's a pretty big thing to look at. Now, for people who have an intracranial aneurysm, no maximum testing at all. It's contraindicated. There are alternatives they can do. So there's stuff that we've talked about in the past, like submaximal testing or walking tests. And you can also do pharmacologic tests. So, um, just like giving a drug instead of actually doing the exercise to kind of stimulate or simulate what's happening. However, for those specifically, the size and location of the aneurysm can determine the appropriateness for the individual. So, yeah, again, very individualized. It depends on the person. Also, max strength training is contraindicated in general. All right, so what are some exercise recommendations? So, moderate intensity aerobic exercise is the main recommendation, and as we've talked about, it seems to be very safe for this population. Any type of contact sport or competitive activity should be avoided, and that's again just to avoid having it rupture or dissect. As the ratio between the aneurysm size and normal vessel size increase, the exercise should be more restrictive. So that goes with constantly monitoring it. Ideally, if they know that they have the aneurysm, they are getting it um, monitored every year. So just keeping that in mind. Um, and just a note here that abdominal aortic aneurysm individuals can safely exercise at 50 to 70% of their heart rate reserve. Now, some general reminders about this population. Patients with cerebral aneurysm should reduce exercise intensity and should not participate in resistance training. Um, so yeah, usually we don't talk about, absolutes here. I mean, usually we talk about it's individualized, it depends on the person, but for cerebral aneurysms, a lot of caution has to be exercised. So definitely take a note of that. Submax training works for them, for that population specifically, so that's fine. But again, remember, no maximum training, maximum exercise testing at all. Um, Maximum strength training is also contraindicated for them, as we talked about. And resistance training of low resistance, high repetitions is appropriate for the abdominal aortic aneurysm group. So, yeah, I mean, we've talked quite a bit about different types of aerobic testing and what you should do and what you should not do for other populations. But I think a big thing here to take home is there are some restrictions for resistance training as well. So, yeah, take a note of that. And yeah, also, yeah, this is the end. Also, I would add that because this is it's related to aging. Just note the other comorbidities that they may have, like frailty, um, like osteoporosis. I mean, anything we've talked about thus far in the course related to age. Just keep that in mind too. I mean, I didn't mention it here, but most of the time these populations have other comorbidities, so take a note of that as well. If you're going to work with anybody who has an aneurysm. But yeah, that is all I've got here. Again, two short chapters for this week. And then we will have a bit of an extended break, which is nice. So I'll see you guys after spring break. Have a good one.